Regardless of educational, racial, ethnic, financial, or spiritual background, anyone can be affected by mental illness. Over 700 million people across the world have mental illness. Unfortunately, there's a lot of stigma attached to mental illness, which makes it less likely for people to seek help. We're here to tell you that you are not alone and help is available.
It's normal to feel extremely sad when something bad happens. What's not normal is depression, and it's the feeling that you can't shake off that sadness. You're always in a low mood, you don't enjoy the things you once enjoyed, and you can't even sleep well. It's not always obvious. People may still smile. If you're concerned about yourself or a loved one, seek help.
It is normal to worry and feel a little anxious from time to time. For example, at that job interview, final exams, or at our driving test, you may have felt your heart beating faster, butterflies in your tummy, or even breaking out in a sweat. However, anxiety can become abnormal if it interferes with your day-to-day life.
As healthcare professionals, we're not exempt from struggles with our own mental health. It's important to break the barrier of stigmatization so we can be comfortable and open to discuss our own mental health. Simple things to do is to first acknowledge these feelings, keep in touch with family, peers, and friends, and also seek the support that we need.
The two most common types of mental health treatments are the talking treatments, where an individual gets to speak to a professional about their thoughts, their feelings, and their ideas. The second one is through the use of a prescribed medication. Again, the use of a prescribed medication does not totally cure mental health illnesses. However, it helps an individual to cope while at home and while at work. Remember not to stop any of these medications abruptly, as this may have a negative impact on your health.
Addiction is a complex condition. Many people describe a severe loss of control and continued use of either drugs, alcohol, or excessive gambling, despite the serious consequences. If you need treatment for addiction, you're entitled to care in the same way as anyone else with a health problem. A good place to start is with your GP. For more information, you can call the Samaritans or visit talktofrank.com.
And young people can also suffer from low mood, anxiety, depression, and other forms of mental health problems. The first place to seek help from would be your GP and school counsellors, who can refer to the community mental health services. There are lots of online resources and apps that are easily available and accessible to both the young person and the parent's guidance. Things like Mindwell, Mindfulness, Headspace, Calms, iApp service, and the Codes. These are good resources to help.
We need to change our mental health attitude. Take care of your mental health by acknowledging your stressors and dealing with them in a healthy way. Seek help if you or someone you know is experiencing symptoms. Speak about it. End the stigma